Hi, everyone. I'm Jeff McInnes. I'm the FQHC Specialty Program Manager here at athenahealth. I am relatively new to Athena. I have just been here a little over 2 months, but I've spent my entire career working with community health centers and also using athenaOne as a user. And so I'm just very excited to be with you all today. And I want to talk about some of the leading reasons why so many of our former Athena practice customers have converted to athenaOne, and particularly what you need to consider as you evaluate converting to athenaOne. And to start out, I want to share this image as a reminder that Athena Health has been on a multi-year investment in community health centers. And this is nowhere near the end of the journey. And this year, we're really trying to bring together all of the pieces for a comprehensive solution for our health centers. Our footprint has expanded to over 13,000 FQHC providers, over 233 health centers and counting, making up 20% of the market. Of our 233 health center customers, nearly 20% of them converted to us from Athena practice, making up almost half of Athena practice FQHCs. And we know that health centers aren't only a safety net, they're foundational to the country's primary care infrastructure. Health centers lift up and strengthen communities, whether urban neighborhoods, rural towns, or tribal lands, and you deliver care to 1 in 10 Americans while ensuring access to care where it's needed most. I don't need to tell you that this is a moment of unprecedented uncertainty because health centers are living that every day. But you aren't backing down. You continue to innovate, adapt, and push forward because that's what your missions demand. And we see that. More importantly, at Athena Health, we're not backing down either. While others may be pulling back or waiting, we're really leaning in because we believe and we know that health centers are an integral part of Athena Health's vision. And that vision is to create a thriving ecosystem that delivers accessible, high quality, and sustainable healthcare for all. I feel like that's really closely aligned with what health centers are looking to create today as America's primary care centers. So I want to dive into some of the ways that we approach developing product and particularly how we focus that towards health centers. Our product organization enters each year with a set of divisional priorities for the network. At the highest level, our product roadmap is organized around 5 divisional priorities. These themes drive every decision we make as an organization to ensure we're continuing to build and iterate on the product in ways that elevate the entire experience for our users end to end. Within these higher level priorities, our community health leads are going a level deeper, incorporating the very specific and unique elements health centers need to be successful. I'll review some of those key focus areas momentarily, but even at the highest level, you can see our divisional priorities are well aligned with many of the priorities emphasized for community healthcare. The first is improving care team efficiency and satisfaction. One of the most significant challenges health centers face is attracting and retaining a strong workforce. We were talking about the LeBron example earlier, but clinicians should not be burdened by inefficient workflows, incomplete patient data, or a one-size-fits-all clinical experience. Our investment here is intended to ensure that care teams are providing optimal patient care with minimal mental and administrative load. The next pillar here is enabling success in value-based care. Our entire network is participating in a wide array of reimbursement models with a full spectrum of experience in value-based care. Some members within our network have an extensive range of full risk contracts, with others just beginning their journey into value-based care programs. Our goal here is to ensure no matter where you are on that journey, Athena is providing both the tools and expertise to ensure you can manage populations at scale, surface relevant and actionable data to close gaps at the point of care, and make it easier to continue to see patients in the most natural way without worrying about clunky workflows and added visit time simply to achieve measure satisfaction. The next item is providing a consumer-grade patient experience. We understand that patient care goes beyond the walls of the clinic, and many patients have a choice for where they want to be seen. Providing a consumer-grade patient experience is about both satisfaction and improving patient health. It's impossible to treat the patient if you can't find the patient or connect with the patient. And we want to ensure that it's both easy for patients to engage digitally with their care team and that providers are able to follow up early and often with their patients to ensure they're getting routine care and being screened for early intervention to prevent high cost and high risk issues longer term. The next is improving practice management and revenue cycle performance. Again, our network is reimbursed under a wide range of fee-for-service, PPS, APM, and value-based payment models. And no matter what kind of an organization you are, strong financial health is the underpinning of strong patient care. No margin, no mission. Our organization is investing in the end-to-end revenue cycle experience to improve transparency, improve configurability, and accelerate reimbursement in full. And we're really doing this particularly with health centers in mind. Lastly is building a durable and open ecosystem. As a single instance multi-tenant platform, athenaOne is the most open network available, and we want to continue to lean into those capabilities. Our goal here is to ensure we're going well beyond basic data exchange and offering out-of-the-box connectivity, creating a creative development platform for innovation and deeper capability for clients of all types. And that goes beyond providers. That includes facilities and payers and partners, so they all can configure their experience in athenaOne. Now that I've shared a more high-level view of the divisional priorities that go into our product roadmap, I want to zoom in on 3 major areas of focus that reflect the needs of health centers today. The first is driving workflows and reporting to deliver and demonstrate high-quality patient outcomes. That includes full visibility into the patient records across external sites of care, specialty roadmaps for women's health, behavioral health, and dental, addressing health-related social needs or social drivers of health through extended care management workflows, and driving smarter, more efficient care through clinical decision support and AI. The next is one that's particularly salient right now, is ensuring health centers are maximizing reimbursement by capturing every dollar eligible. You'll hear we're really rethinking end-to-end RCM experience to ensure accurate rules formatting, automated posting, and transparent FQHC-specific reporting, and particularly improved issue resolution for faster turnaround time on cases to support to adapt to a changing payment environment. Lastly, we're really focused on providing tools that support diversified revenue streams beyond PPS. In addition to working to make sure health centers are ready for UDS+, we're empowering health centers to be successful under a wide range of value-based care models, improving patient pay, efficiency, and schedule density, and supporting community engagement with communication tools and to expand your payer mix beyond Medicaid and really retain your patients. I want to dig into that last pillar a little more. We understand that health centers are being called upon to diversify their revenue sources beyond the traditional Medicare and Medicaid PPS models that have been around for so long. And this is really about ensuring ongoing financial stability. Health centers are navigating a variety of value-based payment models that differ across states, payers, populations, and evolve year over year. And to support them on that journey, health centers need a nimble system that can transform alongside them. At athenahealth, we believe a strategy around each of these 5 areas is required to maximize value-based care success. This is a helpful visualization of what we mean by that, but it only really scratches the surface of what athenaOne has to offer. We try to approach value-based care the same way that health centers approach the patient journey. We break down value-based care into 5 core capabilities, all integrated within the athenahealth platform. The first is predict and identify, helping health centers understand their patient population, identifying those needing care by condition, and determining who requires additional intervention. And that includes social driver of health capture and surfacing those details in the patient chart through using Prepare and Z codes, leveraging a care gap work list, care management programs, the quality tab, supporting HCC capture and risk adjustment, APIs to support risk flags, and a variety of care management support tools and admin discharge transfer alerts. The next is coordinating care to really go beyond the office setting and coordinate interventions like medication adherence and dietary changes for all care providers and supporting health center patients. That includes things like our athenaOne care plans, integrations through Athena Payer, national connectivity to Commonwealth and care quality, our chart sync tool, document management and services, as well as any variety of interfaces, local networks, health plan data exchanges, and APIs. The next is care delivery. We want to make sure that providers have the best patient information to make informed decisions, delivering high quality care and that's optimized both for value and cost and supporting improved patient outcomes. It involves servicing HCC and care gaps from network payers and other data sources, care gap alerts, clinical decision support, using encounter plans and templates to accelerate the documentation process, real-time benefit check to make sure that you get paid for all those visits, and a variety of additional features to support the complex nature of billing and reimbursement for health centers. Next is engaging patients. We want to empower patients with information about their care, understanding the next steps, their role, and really getting them connected and being active participants in their health. That means using the patient portal and the athenaOne app, using automated wellness outreach tools and appointment reminders, offering after-hours operators to make sure your patients can reach you when your offices are closed, auto-publishing results to the portal, and supporting messaging between providers and patients through AI draft responses. We also have a variety of patient education, patient education resources within the chart that are delivered to patients, care summaries and messaging, and tools like telehealth and pharmacy alerts. The next is measure performance, and this is so important. So being able to thrive under value-based payment really requires that you can demonstrate that so much of that work that is at the core of what health centers do is being presented to the payers that you work with. So continuously evaluating and improving the quality of care by measuring how we predict, coordinate, deliver, and exchange information. That includes built-in UDS and HEDIS quality reporting, opportunities to integrate with ACOs, health plan data exchange offerings through Athena Payer, surfacing care gaps from our payer connections, surfacing HCC coding opportunities I referenced before, and supporting quality submission and quality reporting more broadly. These capabilities form the foundation of our value-based care offering, embedded in our products today, and supports health centers in maximizing and diversifying revenue sources, particularly in this evolving value-based payment environment. All right, that was a lot about value-based care. Before I hand things off for a demonstration, I want to emphasize that athenahealth truly values the engagement and feedback of our health center customers. Your health centers are pushing the limit of care collaboration and are the source of some of the most exciting and innovative cases for Athena to accommodate. Our health center product leads engage with our customers through our monthly user groups, the triannual roadmap webinar series, the product research page in the success community, the FQHC quarterly newsletter, through partnership with NAC and PCAs, and of course, through partnership with your CSM.